welcome everybody to the second episode of Thinkers Unlimited. And thanks a ton for the very kind response to episode one with Mark Cox. And it gives me immense joy and pleasure to share with you the thoughts and deliberations with the healthcare leader par excellence, Commander Navneet Bali. He is currently Director Northern Region with Narayana Health. Prior to joining NH, he was associated with ISPL Cancer Therapy Centers as Group CEO and Head of Business. He has also worked with Rockland Hospitals as Unit Director. Before venturing into healthcare industry, he served the Indian Navy for almost 30 years. In the current role at NH, he is responsible for overall strategic planning, operations management, service excellence, and business development of the Northern region. His most recent appointments also include co-chairman National Health Council at ASSOCHAM, member Health Subcommittee at the Institute of Chartered Accountants of India, mentor for Atal Innovation Mission under NITI Aayog, member Delhi NCR Chapter and National Convener Media AHPI, board member of MedML. So thanks a ton, Commander, for accepting my invite and welcome to this show.
It's such a pleasure to be here with you today, Dr. Prashant. It's an absolute pleasure.
So today we are going to take a binocular and kind of look into the future, more specifically the future of healthcare. So Commander Bali, if you had a crystal ball to gaze into, what would you forecast for healthcare in the year 2030?
Yeah, I know, Dr. Prashant, it's a very sort of a difficult task, and so many people have tried to do this to crystal gaze into the future. But let's say, if we were to be given a chance today, and you are giving me that chance today, so I would say that first of all, in single sentence, I think this gadget of ours that we hold in our hands today, I think we have not even unleashed its, 5% of power and how things are going to be in the future. Why I wanted to show you this gadget is because as we have seen during the pandemic, and as I think how the world is going to pan out into the future, we're going to go more and more into such personalized devices and gadgets which are going to be belonging to us specifically, and everything inside that is going to be something that our life is going to revolve around. That means one thing that I can for sure tell, and we got around 10 years to reach there, is that a lot of things which are to be dealt with personal healthcare and wellness are going to revolve around this gadget which I just showed, that is our mobile phone. It will be very unfair and inhumane to say that it was a pandemic which sort of goaded us towards adoption of technology in healthcare, but because pandemic also results in many deaths, and it was sort of a very, very tiring time for healthcare workers for last almost an year now. But yes, I think the present pandemic was, as I keep saying, like a curtain, which when we sort of moved it away, and we saw that already there is laid out fields of technology in front of us. And you must have seen, as you yourself are sorry, are into healthcare, that a lot of things that we actually were always contemplating to do. I think you must have heard telemedicine for I don't know, so many years, now the telemedicine and how to go. But actually speaking, when it became very, very necessary, and we saw that telemedicine, especially on online consultations where patients could not come and visit the doctor, that became such like a vogue. And every time a patient asks the doctor, is it important for me to visit the hospital, can't you do it on phone? So these questions. And naturally, when people could not move, when people were afraid to go into the hospitals, it somehow pushed humanity towards doing things from their own comfort zones where they felt comfortable. And also they felt that there was no need to go to a hospital where they thought that it's quite possible they might get infected. So somehow COVID has been able to move us into that direction. And I think going forward up to 2030, you are going to see a logarithmic increase in the way technology is going to intrude into healthcare. whether, and we keep talking about these terms in a very loose manner, whether it's AI or it is machine learning or it is, remote possibilities of how healthcare is. But the truth is, these were just waiting around the corner, and now these are the ones who have come in the front. And I think by 2030, and let's say, you again are interviewing someone at 2030, and when we look back upon this interview today, the discussion today, you will see that many of the things that we said would almost be possibilities by then. So that is the way I feel it is going forward, Dr. Prashant.
So if you look at, India as a country, and we have actually two Indias. There's an India which is the urban India, and there's a Bharat which is the rural India. Do you think that all this which is happening in terms of technology will have a similar impact, say, in the villages, or you see that things there will be moving in a different direction or slower than probably what is happening in urban India?
Truly, if you ask me, Dr. Prashant, the manifestation of technology is much, much more required in rural and places which are inaccessible. You know, Specifically, if you look at the whole ecosystem now, and I think this is very, very important to understand. Uh, when there is a ingress of the population from villages to the cities, and that means good talent moving from villages, tier 2, tier 3 cities into tier 1 cities, good doctors wanting to have a better quality of life in tier 1 cities, doctors moving to see where they are paid more handsomely. Obviously, in that regard, your tier 2, tier 3 cities are way back, because for everything that a person aspires for a better life, it is available in metros or better cities. So that leaves our villages, our inaccessible places, our towns and small districts in far-flung areas, in areas which are not so economically which are economically backward, bereft of this clinical talent. And also because, but then uh, the other way around also hits them, because you see a lot of these places also are very much subjected to poverty. They are also very much subjected to diseases. And if you really look at it, except for the lifestyle diseases, obviously, like diabetes, maybe which, it is very urbanized kind of a disease, there are many things which are happening in these villages and towns and places. So actually speaking, if technology has to have any meaning at all, especially in the context of our country with about huge population that we have, I think it has to, no doubt, intrude much more into villages and into towns and tier 3 and tier 4 and such kind of cities, because that is where it is required the most. If I'm sitting in, let us say, Delhi, like me and you right now are, of course, I mean, let us say we have technological sort of inventions and means available. I have a mobile phone, I can do a teleconsult, but it is also that there's a good doctor right next door. There are at least 4 hospitals in a vicinity of 2 kilometers right next to me. So even if I want to, I can very well go there. But let us talk about a remote village in jungles of northeast India. Let us talk about a very, very inaccessible place, let us say in Leh Ladakh. Let us talk about a place where you, and I remember in my village in near Baramulla, we just had electricity coming some years back. I mean, in those places, I think we need this to happen much more. So if your question is whether those areas will get the advantage, I have my doubts, because until unless we are started thinking towards getting the infrastructure right, getting our internet and things like that in place, and start thinking about it now, I think by the time we, let us say, we keep a context of 2025, 2030, I think it will be very, very difficult for us to reach. So, but truly speaking, that is where the complete focus has to be, because we already got that almost in place in Delhi, Mumbai, Kolkata, things like that. Yeah.
Agree with you. Agree with you. Now, if you look at courtesy COVID-19, which you have touched upon, home healthcare, teleconsultation, the growth has just gone through the roof. Do you foresee that going forward, hospitals will become the choice only for critical and surgical care in the coming years?
I had written a article long time back, and I mean, this is again one of those things that I sort of predict, or as you rightly say, crystal gaze into the future. what you say is the way I think hospitals are going to be. And so everything that starting from the hospital construction to the way hospitals are going to be made and designed, I think will be exactly the way you have said, and that is what I feel. So that means hospitals are going to be institutions where you have primarily surgical interventions happening, number one. Number two, you have primarily such machines, let us say a linear accelerator, which costs around 20, 30 crores, and it cannot be built in your house. So people going towards getting those kind of things at hospitals. And along with that, you have their built-in kind of post and pre-operative rooms and critical care areas and emergencies maybe. I have a feeling that everything else, everything, and that includes, I mean, infusion of maybe chemotherapy drugs, infusion and dialysis happening at homes. That includes almost everything. Obviously, the legal paradigm also has to shift along with that as the technology, makes, because, you'll have to keep protecting the clinical healthcare workers from those parts. But I have a feeling that future hospitals, although it is not yet started, there's just a idea right now, because some of the healthcare business leaders will have to start constructing or thinking of constructing such hospitals, which, let us say, are just about, let us say, 20 OTs in a maze with their post and pre-op, along with the maybe diagnostics, so that it helps the surgeon. And that is a way I think for sure, because we have realized that most of the other things can be done at home. And as you rightly said, I mean, home healthcare saw a huge boom because people felt that you could, in fact, convert your bedroom into a fantastic ICU. You require some gadgets. It could be controlled remotely. It could be monitored remotely. You didn't have to go to a hospital ICU. And also, in that same article, I had written that hospitals are limited by the number of beds and the capacities. If you have only a 60-bedded ICU, you can't have more than maybe 60, 62 patients, even if you try to squeeze in some here and there. So that limitless bed capacity only exists when you start doing things in this manner. But I feel that that's the way it is going to be.
So, IBM Watson is making cancer plans, and, robotic surgeries are becoming more and more common. And this is one thing, like in the future, people are a little worried about. Do you see that eventually a robot shall replace a doctor?
Um, in my belief, humans will never be replaced by the machines, because even if you look at the industrial revolution, when the power loom started coming and you had a huge amount of and other machinery came in. I mean, I'm talking about London, I'm talking about the UK, and it all started from there. And even that time, the humans started doing things which are much more pleasurable, much more easier, much more enjoyable. So drudgery and the repetitive things gave way to something that humans required more brain. So you had machines, but you had people who had to look at if the machine is functioning properly. If you had, so in my viewpoint, although it's a future which is just waiting to happen. And IBM Watson, actually, many years back, when we were in ISPL, and before that, I mean, they started giving the predictive medicines for medical oncology, and that is where they stepped into looking at the huge amount of data, and they gave the doctor a little bit more clarity of what the ultimate drug of choice is going to be, depending on the genetics and all sorts of artificial intelligence, AI, ML, for quite good result. But obviously, when I did a study in IBM Watson, I realized that you have to have a huge support of a good clean data to back your things up. If a doctor is going to make a decision based on IBM Watson's predictability. So of course, that is still work in progress. I'm sure there are many more such AI based platforms which are going to come. In my viewpoint, robots are going to do a huge amount of, because they are more precise. They are not sort of influenced by emotions. They can work 24 into 7. They could be remotely controlled by higher speed and higher bandwidth networks. But I'm sure humans will do something different, which will again evolve. So it may not replace what doctors are doing, but I think doctors will start doing something which is much more evolutionary, higher platform than what will happen. And that's what I think is going to happen.
Great. And this is something which we keep talking about in the healthcare sector in terms of where are we going in terms of we've seen a tremendous spurt of so many single specialty chains of late, from eye care to oncology to IVF. How do you see the future balance of multi-speciality versus single specialty care going forward? In which direction are we going? Is it going to be still the same mix, or you will have more, leaning towards one side? What's your take on this?
See, business-wise, many times it was felt that single specialty hospitals, if they are run in a very sort of efficient manner, give you much higher profitability and EBITDA because you are very focused on what you're doing. The consumption, the supply chain issues are sorted out, and it's a much more efficient way of doing things. But except for eye and oncology and maybe one or two, many of these actually did not sort of you don't have a single specialty clinic except hospitals other than these. But in my viewpoint, I foresee going in the future, because as if the whole idea is to revolve around surgical units being called as hospitals, and many things happening in home healthcare and etc. And especially when we move towards very, very verticalized healthcare treatment, in my viewpoint, 5 years from now, many of these single specialty hospital chains or single specialty focused hospital chains are going to have a tremendous comeback. In fact, you might have very, very finer and thinner laser pointed specialties which you look at. Even in that single specialty, you will see a very, very sub-specialized kind of things happening. And that is going to happen in the future because people are going to be much, much more aware. Rather than going to a generalized kind of a multi-specialty hospital, they might as well go to an organ specific or a disease specific kind of a thing. So I foresee that as technology moves and as we move in tandem with everything that we have talked about, so hospitals being on the places where people go to get surgeries or major things, you have AI/ML platforms moving in, you have your mobiles as your data centers and as your health devices. I have a feeling that we will see much more this attention and much more focus on very, very vertical specialized single specialty chains.
So if you see, some of it is already happening in the United States, particularly where even doctors and hospitals have, as you said, disease specific and literally going down to that, and that is the demand also. But I think yes, I'm sure that the same things we are going to be expecting because we are sometimes 10, 15 years behind what happens in the West. But I agree with you that what is already catching up there in the West will come here, and we will get that kind of a change over the period of time. So the thing which I have a lot of interest in this technology, and I think you started also talking about the mobile phone, and it's making deep inroads in how healthcare is being delivered. What, according to you, are the untouched areas where you see technology further contributing in this delivery system where it has not yet done?
Yeah, so I think one of the areas where, when we talked about IBM Watson, it was a kind of a clinical, pathway which it looked at. I have a feeling that to make the healthcare system much more robust and much more efficient, as you're aware, a patient just spends just about 30 minutes, 40 minutes with the doctor when he comes from OPD. Then he goes to the hospital. I mean, there's a surgery which could last whatever, starting from half an hour to around 8, 10, 12 hours, depending on the type of surgery, and that's all about it. And then the entire other things are happening beyond the realm of what is directly involved with a clinical thing. So first and foremost, very, very importantly, Dr. Prashant, everything which is beyond what I've talked about is a very, very inefficient system in healthcare. So I have a feeling that your artificial intelligence, machine learning, will come into big time into everything else which happens beyond, even which is, I mean, you can call it typically a non-medical kind of a thing, where everything else a patient has to go through, whether it is waiting for the OPD, getting his insurance cover done, whether it is predictability of how much time he's going to stay, whether it's predictability of his bill, whether it is he requires to go or not, all the algorithms and everything will come. That is number one. The second area, which is going to have a huge, huge sort of it has a huge potential to grow, and where we are not yet talking about it is the realm of wellness. People will realize that, I think that old adage of a stitch in time saves nine. People are going to realize that they don't have to actually go to hospital. If some things are done which might include, anything from, predictability, which you see in many of these genomic platforms, coming into your effects of environment and what you eat and the air type of air you breathe, all those variables put together, what kind of, lifestyle should you be living, what is the kind of things you should be doing. I think the wellness part, certainly in the developed countries, it's going to happen very soon, and also countries like India, where we have seen that maybe because of some of our good things that we did in the past, like, it is of course not proven fact, but many of our vaccination programs, the way we, lived our childhood, it gave us that kind of a huge amount of impact in the way COVID acted on Indians. So if you look at today, whatever the figures right now are, I'm sure the denominator is much, much more bigger. So your death rate, which death percentage, which is showing as 1% today, I'm sure it is less than 0.5, 0.6, 0.3 kind of percentage. And that is because of the way we dealt the whole thing about it. So in my viewpoint, these are the two very, very important areas in addition to what we talk about. One is the wellness and everything associated with it. So the going to the hospital only remains, as we talked about in the beginning, to do something which you cannot avoid despite, eating good food, despite doing everything that you need to do, but something still happens and you have to go to hospital. And second part is everything non-medical, which becomes absolutely simplified for a patient, and for him, if he has to ever go to the hospital or if he has to ever go through the journey, it is absolutely simplified.
So, see, we both are some, people who are working in the operations, the patient care part, and something that is very close to both of us. In terms of the patient experience of what we are able to deliver today, whether it's in India or in the West, do you see changes happening in that part, in that patient experience, the journey that the patient has going forward? Do you see changes in the future? What do you predict will happen? What are the things which are probably ailing the system today, which will kind of get overhauled in the future?
Yes, tremendous changes are in store, and I think all good healthcare chains have started looking at it. Just to give you an example, from the point a doctor says discharge, writes mark for discharge, uh, an insurance patient might take as much as from 6 to 8 hours, or that much amount to finally get out of the hospital, because when he says discharge, then something's happened, then it is sent to the insurance company, then the insurance company says discharge. And can you imagine a patient for whom a mark for discharge is written in the morning at around maybe 12 o'clock, finally leaves the hospital at 8 o'clock? I'm just giving you one small example. Then there are many examples like this where, the patient, when he gets admitted, the family does not know how many days he's going to spend. There is, although, you have financial counselors sitting when you enter and they give you an approximate bill, the family usually ends up paying either much higher bill. So there is huge amount of dissatisfaction there also. So, I think all this is going to be the thing of the past, especially in good healthcare, and others are going to be, falling apart, to the side, because, patients are going to become much more choosier. They know that if everything is done, for them, which makes them, so, it's going to kind of remove that stress of, going through this horrible thing, as it is your body is stressed because you are going to be maybe surgically operated or something else is happening. On top of that, you have inconvenience. On top of that, you have huge amount of waiting times at different places. You have bottlenecks all around the place. You have financial stress. You don't know what's going to happen. So I think, in my viewpoint, all good healthcare systems, all good healthcare organizations are going to look at it, and no doubt about it that it is only northbound, the whole paradigm of patient care, and it's going to really, really benefit patients in a big way.
So, thanks once again, Commander Bali, for this very stimulating discourse, which actually takes the journey of this channel forward in the best way possible. I would encourage the viewers to like this video, subscribe to this channel for more such content, and also press the bell icon. And thank you. And actually look forward to seeing many more people and thinkers like you, so that we can share, thoughts to everybody.
Thank you for inviting me, and Happy New Year to everyone. Wishing good health and peace to all your viewers, Dr. Prashant. Thank you very much.
Happy New Year to all. Thank you. And until we meet again, stay safe.
Thank you very much. Stay safe.